Hello, my name is Tamika Hobson, and this is my Nursing 444 Community Health Project on congestive heart failure. I'm a nursing student at Indiana State University. I ask that before you watch this presentation, you pause it and take the pre and post test found in the description box below. The results will not be recorded. It is just to assess your knowledge of congestive heart failure before you watch the presentation. And you will be prompted to take this again at the end of the presentation to assess how much knowledge you've gained. Please pause at this time. Now that you've taken the pretest, after watching this presentation, you should be able to define what CHF is, identify who is at risk for developing congestive heart failure, recognize signs and symptoms of congestive heart failure, differentiate between the two types of congestive heart failure, explain how CHF is diagnosed, and list treatments for CHF. To understand congestive heart failure, you have to first understand how our circulatory system works. The heart is basically a muscular pump that helps circulate blood throughout the body. The right side of the heart receives blood that is low in oxygen from the body via the vena cava. That blood is pumped into the lungs by the right ventricle, where it loads up on oxygen from the air that we breathed into our lungs. Then the blood moves to the left side of the heart, where the left ventricle pumps the oxygen-rich blood back out to the body via the aorta. The body tissues and organs exchange their carbon dioxide or CO2 waste for the oxygen in the blood. The blood is then returned to the heart and the cycle repeats. Congestive heart failure is when the heart muscle becomes so weak, stiff, or damaged that it can't pump the correct way and isn't able to distribute the amount of blood that the body requires to function properly. And there are two types, right and left-sided heart failure. Right-sided heart failure usually has symptoms that affect the body more, and left-sided heart failure usually has symptoms that affects the lungs more. Some risk factors for getting congestive heart failure is being 65 years older, being an African American, being overweight or obese, having a history of a heart attack, being a male, being of low socioeconomic status, or having comorbidities, which are just diseases that increase your risk for heart failure. Some causes of heart failure are coronary artery disease, various heart conditions, having uncontrolled high blood pressure, and being a diabetic. There are two types of congestive heart failure. Right-sided failure is where the right ventricle is unable to pump the blood into the lungs effectively. And because it can't empty the blood inside of it, the blood from the body can't move into the heart. So that causes everything to back up, so the blood backs back up into the body. And with the left-sided heart failure, the left ventricle is unable to pump the blood to the body. So there's not enough blood pumped out to the body, so those tissues don't get enough oxygen-rich blood to function. And the blood or fluid inside of the lungs can't come out of the lungs into the ventricle, and so everything backs back up into the heart. So that can also lead to right-sided failure because the ventricle doesn't empty, the blood from the lungs don't empty, so the blood from the right ventricle can't empty, which means the blood from the body can't come into the heart. Right-sided heart failure signs and symptoms. Right-sided heart failure is sometimes called cor pulmonale, and this is again when the blood cannot come into the heart because the ventricle has not pumped all of the blood that was in it into the lungs, and so the blood backs up into the body, and the person can experience fatigue. They can experience ascites, which is a buildup of fluid in your abdomen, and this can also cause enlarged liver and spleen because the blood that's in the liver circulation can't pump out and return to the heart. So everything backs up and the blood just sort of sits there, causing the liver to get larger. It also can cause distended jugular veins, which is veins in the neck, and this is because the blood that's draining from the head drains from the jugular veins down into the vena cava into the heart, but because it can't do that, it backs up, and this causes those veins to become stretched out. Some patients can complain of not having an appetite and gastric distress because, again, things aren't flowing and the blood isn't leaving that system as it should. and you can get weight gain because all that fluid that should be returning to the heart to be recycled and pumped back through into the circulation is building up in those tissues in your legs. And so it's causing you to gain weight as the fluid builds up more and more. And dependent edema is just that fluid sitting in your legs and your feet and your lower extremities and your abdomen is just building up. So left-sided heart failure, it can cause something called paroxysmal nocturnal dyspnea, and that's when you're trying to go to sleep at night and you just have a hard time breathing. It can cause pulmonary congestion because remember the left-sided heart, it can't pump the blood from that left ventricle out to the body. And so because it can't empty itself, the lungs can't empty the blood into the left ventricle. So that fluid in the blood just sits in the lungs and it causes a cough. It can cause crackles because all that fluid is sitting in there. It could cause wheezing because it makes it hard for gas exchange. If there's fluid sitting in the lungs, it can't exchange oxygen and carbon dioxide with the oxygen that we breathe in the air. You can have blood tinged sputum, a fast breathing rate because your body is trying to make up for the oxygen it doesn't have, so it's breathing faster, trying to get more oxygen in. Orthopnea is when you're laying down and you have a very hard time breathing. So a lot of times these patients have to sit up straight. Tachycardia, which is just a fast heart rate because your body is just trying to force that blood out of the heart. Exertional dyspnea, that's when you get very fatigued when you try to do any activity. Sometimes just walking, just sitting up, just makes you very, very short of breath. And again, the fatigue. And cyanosis, as you see in the drawing, blue lips, blue toes, blue fingers, because the heart is unable to pump that oxygenated blood out, and because it doesn't pump out oxygenated blood that meets the body's demands, the tissues become oxygen starved. So they basically diagnosed congestive heart failure by a doctor's assessment. They take a look at you and they look for those signs and symptoms mentioned in the previous slides. They also do various lab tests. One of the most important is the BNP or B-natriuretic peptide. It tells them how far advanced your heart failure is. They can do an ECG or an electrocardiogram to look at the electrical activity of your heart. They can do an echocardiogram, which can show them how the blood is actually moving inside of your heart. They can do a cardiac catheterization where they go inside and they can actually look inside of your vasculature and inside of your heart. They can do a chest x-ray and that can show them signs of pulmonary edema, which is that fluid building up inside of your lungs. They can check for hepatic jugular reflux, which will let them know if it's right-sided heart failure. And they can look at that jugular vein distension, which could also give them a clue about if your heart is pumping correctly. Treatment for congestive heart failure mainly is supportive therapy to preserve and optimize remaining cardiac function. They want to treat the underlying cause of heart failure if possible. They want to modify your risk factors and do lifestyle changes. So if you're overweight or obese, they want you to lose weight. If you have uncontrolled high blood pressure, they want you to control your blood pressure. And that's where the next treatment is medication. They want to treat your blood pressure, your cholesterol, your fluid volume overload. If you can tolerate it, they want to put you into cardiac rehab, which is basically physical therapy for people with heart problems. And if all else fails, you have to get a new heart. You need a heart transplant. Prognosis for congestive heart failure is poor. 1 in 9 deaths in the United States had heart failure as a cause of death. That's because heart failure significantly increases your morbidity from other diseases, and it also increases your risk for death. Because once damaged, the heart muscle does not get any better. We just can manage your symptoms and slow the progression of the illness. And that's the main goal of treatment and therapies. If you would like more information on heart failure, please go to the American Heart Association's heart failure page. It has all the information mentioned in this presentation, as well as stuff that is not mentioned in this presentation. I ask at this time you retake that test again and see how much you learned from this presentation. Thank you for taking the time to look at it. Have a good day.